Today we're going to talk about insulin resistance and diabetes, the root cause for prediabetes and type 2 diabetes. Your body may be producing insulin, but not listening to it. That's called insulin resistance. Insulin is supposed to move sugar from your body into your cells for energy. But when your cells stop responding, sugar stays in the blood. So your body makes more and more insulin trying to keep up. Over time, blood sugar rises, weight gets harder to control, and prediabetes and type 2 diabetes begin. The scary part, this can be happening for years before you know it. So control insulin resistance early before diabetes take over. Do you know if you have insulin resistance? Wait, in less than 1 minute, I'm going to tell you how to find out. So how do you know if you have insulin resistance? Insulin resistance can be building for years before prediabetes or type 2 diabetes show up. So how do you know if you already have it? Common clues include belly weight, belly circumference, what we call increased intra-abdominal or visceral fat, sugar cravings, feeling sleepy, especially after meals. Often, some people have dark velvety skin around the neck or even under the armpits. It means your body is making insulin, but your cells are not responding well to that. If this sounds like you, don't ignore it. There is an epidemic of this phenomena in our young people right now from the age of 15 to 35 years old all over the world. It's important that we catch it early, improve it early, and you may prevent prediabetes or even type 2 diabetes. So if you have insulin resistance, can you reverse it? That's very controversial. I'm going to tell you if you can in a minute. So can you reverse insulin resistance or even diabetes? I would say yes and no. Insulin resistance can often improve before it turns into full diabetes. The biggest moves are simple. Lose a little bit of weight if needed, move more, stay consistent. Even losing about 5% to 7% of your body weight and getting at least 150 minutes of moderate activity a week can lower your risk and improve the way your body handles blood sugar. For some people, doctors may also use medicines like metformin, but lifestyle changes remain the foundation to prevent or even cure insulin resistance. If you start early, you can do it because insulin resistance is easier to improve before diabetes or sets in. So the answer to the question, can you reverse insulin resistance? Yes or no? It all depends on you. Meaning, if you keep up the fight, if you keep up the good work, then you can keep insulin resistance and diabetes at bay for long periods of time. But the moment you stop fighting, it will come back with a vengeance. So how do you start and keep the fight? I'm going to tell you in a couple of seconds. So there is no simple magic way to fight insulin resistance. But if you start with the right foods, that can absolutely help. Build your meals around non-starchy vegetables like beans, lentils, whole grain, certain whole foods in sensible portions, and lean proteins. Use high fiber carbohydrates. Those help the blood sugar spikes, and balanced meals can also lower how much insulin your body has to release. The foods that usually hurt most are sugary drinks, refined carbohydrate, and ultra-processed foods, especially snack foods. So eat more fiber, more real food, and make it consistent. That is how you fight insulin resistance. That is not an easy fight. Not an easy fight at all. A very common question you heard often from people with diabetes, can I eat fruits? Well, I'm going to tell you what type of fruits you can eat. Can you eat fruits? Yes, you can, and certain foods can even help you with insulin resistance and diabetes. So the best choices are usually fiber-rich whole foods options with low glycemic index, meaning they don't spike your blood sugar. And low glycemic index for prediabetes and insulin resistance, as well as diabetes, is a glycemic index, let's say, of less than 50. Like cherries, glycemic index of 20. Grapefruits has a glycemic index of about 25. The berries like blackberries and raspberry, glycemic index of 25. Apple, glycemic index of 39. Pears, glycemic index of 39. Oranges, glycemic index of 40. Pomegranates, glycemic index of 35. Plums, glycemic index of 35. Apricots, glycemic index of 34. Peaches, glycemic index of 42. Avocado is probably the best one, glycemic index of 15. Guava, glycemic index of 24. Even strawberries, glycemic index of 41. Those fruits are all really good to prevent insulin resistance and to use if you already have diabetes. Remember, no added sugar and still control your portion size. Whole foods fix into a healthy diabetes-friendly eating pattern, and fiber also helps slow digestion and supports better blood sugar control. Fresh is always better than dry foods. So choose fresh fruits, frozen or canned, without added sugar, and be careful with juice because juice can raise your blood sugar way faster than whole foods. So very important to remember that. Okay, now that you know the best food for diabetes, what about the worst foods? What are the worst foods for insulin resistance and diabetes? The worst foods are usually the ones that spike sugar fast and keep you overeating. Think of sugary drinks, sweets, white bread, pastries, chips, and other ultra-processed carbs. These foods are often high in added sugar and refined carbohydrate. They will push your blood sugar up quickly and make insulin resistance harder to control over time. Small changes done consistently can make a big difference. Choose one day during the week to cheat a little. You cannot cheat every day with food. You gotta control your portion size, and most of the time you gotta choose great food, natural food. So what are the worst foods for diabetes? I just told you the great foods, what they are, but which ones you should not use? For insulin resistance, remember, the biggest problem usually is not whole food itself, is the form it comes in. The worst choices are usually fruit juice, large portions of dry fruits, and fruits packed in heavy syrup. Juice gives you a lot of sugar first and less fiber. Dry fruit is concentrated, so it is easy to overeat, and syrup adds extra sugar your body does not need. Also, eat less foods that have high glycemic index, usually glycemic index more than 50, such as watermelon has a glycemic index of 75, pineapple, glycemic index of 65, dry fruits and raisins, glycemic index of 65, white bananas, glycemic index of 60, mangoes, glycemic index of 60, papaya, glycemic index of 60, grapes, glycemic index of 55. Those foods will spike your blood sugar if you consume them in big portion. You can use them sometimes on rare occasion for cheating, food for pleasure, that's fine. But remember the good ones without such a high glycemic index, like berries, apples, pears, and the ones that I mentioned earlier. And keep portions sensible. Whole foods always gonna beat any juice. Remember that. Click on the link above so you can watch part 2 of this video.